Preventive and Solvent Treatment of Calculus. Inasmuch as the discovery or passage of a single stone suggests the possibility that others may be present or may subsequently form, every case of urinary calculus presents the problem of how to prevent the recurrence of stone, while many patients, moved by the blazon of the Buffalo Lithia bottle, inquire, "How shall I dissolve my stone?" As an elementary proposition, we may state that urinary calculus cannot be dissolved. Unless it is passed, it must be removed. Spontaneous fracture will not help matters. But medical aids may very properly be invoked under two conditions. One, to aid the passage of a small ureteral stone, page 400. Two, to prevent recurrence of stone after all calculi have been passed or removed. No treatment can guarantee success in either event, but treatment should be conducted along the following lines. Secondary stone. For the prevention of secondary stone, we depend upon the cure or control of the inflammation causing it. Primary stone. The treatment includes 1. Relief of retention, 2. Dietetics, exercise, encouraging elimination by other avenues, 3. Diluting the urine, 4. Specifics. 1. Relief of retention. In the past, our attention has been centered upon more or less futile attempts to prevent the formation of stone. Footnote. Thus, Rosenblum observes that though urates are more soluble in alkalis, oxalates are more soluble in an acid medium. The future will see more attention paid to attempts to prevent the retention of stone. For, as stated above, stone formation is of small importance as compared with stone retention. No diet, medicine, or mode of life is guaranteed to prevent the reformation of stone. But good surgery may often guarantee the prompt passage of any stone that does reform and may thus solve the problem of the patient's cure. The details of the relief of retention are dealt with specifically for each type of stone. 2. Hygiene. Hygiene and mode of life have nothing to do with the cure of phosphatic stone, since this is secondary to infection, nor with the amorphous urate stone, for this will inevitably recur in the bladder unless relief is afforded to the retention. Hygiene relates only to the oxalate stones that form in the kidney. The two great stone-forming periods for oxalates are intrauterine life and perhaps early infancy, and the years between 30 and 50. Why oxalate stones should prefer these periods is not quite clear. They might perhaps be called sedentary, though mothers and golfers would deny that. The two factors of the greatest importance are, on the one hand, an excessive nitrogenous intake, and on the other hand, an excretory sluggishness, perhaps an actual retention of urine. The fetus we cannot reach, but the middle-aged patient begins to have renal colic during the time when he is exchanging tennis for golf, or giving up exercise altogether, really settling down to the hard struggle of self-support, or the even sterner struggle for success, is likely to smoke too much, to drink too much whiskey and too little water, to overeat, to be mildly constipated, perhaps to show indican and a high blood pressure. Such a man requires exercise. Exercise is the use of the muscles in the open air in an enjoyable fashion, so violently as to cause perspiration. His diet should be low in nitrogen. Alcohol, tea, coffee, and tobacco should be used sparingly, and his bowels should be kept freely open. 3. Dilution. The difficulty with all the above restrictions is that they are not for 3 months, but for 20 years. Unless they are prescribed with a very clear understanding of the patient's personality, they are futile. On the other hand, the patient is usually quite willing to return twice a year for urinalysis. Advantage may be taken of this to insist that he drink enough water to keep the specific gravity of the urine down to or below 1.015. So long as this is done, the likelihood of stone formation is relatively slight. Patients who have difficulty in keeping the urine thus diluted will be much assisted by an occasional course at a diuretic or cathartic mineral spring. The English, than whom one could not ask for better authority upon such a subject, show a strong preference for Contrexeville and Carlsbad. French lick in Indiana is of benefit to many persons. 4. Specifics. Specifics for stone appeal so little to the modern mind that it seems scarcely worthwhile to enumerate them. Casper advocates the use of glycerin in tablespoonful doses, both to prevent the formation of calculi and to favor their passage.